We're starting. So I want to say just a couple of things about the general classification of helminths and antihelminthic drugs. So here you need to know three classes of helminths: nematodes, or roundworms. This is one of the nematodes shown here. They probably the most advanced ones. So cylindrically shaped body. They do have a body cavity, meaning that they have a bunch of organ systems like digestive, reproductive, nervous, all that kind of stuff. And all roundworms, no exceptions, have male and female sexes. So in order to mate, in order to reproduce, roundworms, in order to start producing ova or eggs of a roundworm, a person must be infected with both male and female. Does that make sense? If the person is infected with only one worm, it's not going to lead to any reproduction in that person. Okay? Nematodes. Here, so-called flukes. Okay? So this is Fasciola hepatica, just as an example. How big they can be, that's Fascioloidis magna. Fasciola hepatica, this is about 1 inch. So like 3-4 inches, that's pretty, pretty significant. Like a size of a human palm, approximately. They're also called flukes. They are flat and not segmented. They do not have body cavity. Some of them have certain fairly rudimentary organ systems. And they are hermaphrodites. For our intents and purposes, we're going to consider all nematodes hermaphrodites. There's one exception you don't have to focus on. Does that make sense? So think about them as hermaphrodites. And finally, cestodes, or segmented tapeworms. This is the beef tapeworm, Taenius aginata. They're flat, they're very primitive, no organ systems, no body cavity, and they are all hermaphroditic worms as well. Got it? Now, antihelminthic drugs. Again, the problem with helminths is that they're not just eukaryotes, they're multicellular eukaryotes. So you've got to collect something that would have very specific toxicity, okay, without affecting humans. Now, another problem is that worms reproduce slowly. So if you block reproduction of a worm, you can prevent ova from forming. Does that make sense? You're preventing eggs from forming. But an adult worm infection will still be a problem. You see what I'm trying to say? So the main approaches to the treatment of worm infections is to immobilize a worm or to inhibit the worm metabolism, mainly cell division, because that will impair growth, and if you kind of tip the balance towards more cells dying than dividing, the worm eventually will die itself. So there are two drugs that I want you to know. I didn't include Purentel here. One is, we can call them bendazole drugs. So that's mebendazole. There's a derivative called thiabendazole. Those are broad-spectrum antihelminthic. In fact, if you will go to a pet shop, like a PetSmart or something, and they actually sell over-the-counter antihelminthic medications for cats and dogs. And if you pick up one, it's likely to contain mebendazole. or thiabendazole, one of these two. Does that make sense? Works pretty well on humans and dogs and cats and cows alike. It inhibits the microtubule synthesis. Essentially, as you may remember, microtubules are essential for cell division. There's no cell division, worms eventually die. That makes sense. So basically, if somebody has the infestation with Tinea saginata, okay, treating that person with mebendazole will eventually lead to passing the worm out, which can freak out certain people. Okay. Second drug, big drug, is ivermectin. So ivermectin, as one parasitologist explained its structure, shown here at the bottom, 3-hydroxy chicken wire. The developer of ivermectin are two guys, American and Japanese. I remember American guy, I think is Bill Campbell, and I don't remember Japanese fella. So ivermectin was developed in a company named Merck. Okay, it was pretty interesting. One of the employees brought a sample of a soil from somewhere. They isolated a chemical that turned out to be a pretty effective drug against worms, especially round worms, like whipworms or trichinella or hookworms. Okay. Now, the mechanism of action for ivermectin is totally fascinating. Worms have chloride channels that are chemically gated by the glutamate. Okay, so if this channel is open, chloride flows into the worm, right? Chloride is negatively charged. Negative charge that gets into the cell hyperpolarizes the cell, and that leads to inhibition of the nerve transmission. Does that make sense? Ivermectin binds to that channel, okay, and stimulates the influx of chloride, leads to hyperpolarization of the muscle cells and nervous cells in the worm, and worm cannot move. It doesn't die. You have to understand, it doesn't die. It just cannot move. And since it cannot move, it cannot reproduce. Make sense? Now, because of that treatment, one disease is almost completely eradicated thanks to Jimmy Carter Foundation. The infection known as onchocerciasis or river blindness is almost completely eradicated in Africa. This is the roundworm infection that leads, as you can imagine, to blindness. In fact, Merck provided the drug for onchocerciasis. They provided ivermectin for free. The only money that Carter Foundation was spending is to deliver and distribute it. Does that make sense? You may ask, hold on a second. Merck, what do they make money from then if they provide ivermectin for free? Ivermectin is the main component of the heartworm treatment for dogs. And the reason why you have to give the heartworm treatment to your dog every month is because it paralyzes possible worms. So heartworm is transmitted via mosquito bites, okay? And treatment with drugs like HeartGuard or any generics that offshoots of this will paralyze so-called microfilarial form, really, really tiny worms. They won't be able to grow, they won't be able to move, they won't be able to reproduce, and eventually they will die, your dog will pass it out. That makes sense? But your dog has to be tested, because if the heartworm infection is already there and it's pretty severe, then treatment can be actually dangerous, because you're going to get a bunch of paralyzed worm lodged in the blood vessels or in the heart. That makes sense? But that's veterinary ivermectin is where these companies make money from. That's still delivered free to Carter Foundation to treat folks in Africa. So we're going to stop at this point.